Now, my understanding is that this initiative by insurance companies, many people hold the opinion that it's purely a profit grab by the insurance companies. Their motivation is not sincere, relevant to taking care of citizens, but it's all about wanting to make more profits on the backs of citizens and healthcare providers. I understand that when the Republican committee chair, Mr. Lund, the sole sponsor of this bill, House Bill 4936, when he took the caucus before the insurance commissioner, Kevin Clinton, and Kevin Clinton was asked by our legislators, will you provide us with this information? He said, we don't have to give it to you. We're not going to give it to you. And even if we did give it to you, you couldn't understand it.
That's correct.
Now, what was your sense of the reaction at that meeting?
Well, it went silent because people can't comprehend that I can't get the information from my own state government to make a good decision. So the reaction was like, well, we're going to get this information one way or another. And so the reaction was they were kind of appalled that I have to make a monster decision for my constituents, and you just will not release this information to me. And it kind of broke up the caucus, and they moved on because at this point there was no way they could have a discussion after that point.
Well, I thought it was the height of arrogance for him to say that those of us that are in the healthcare arena already, we're job creators, we have tens of thousands of employees, that we couldn't understand the financials involved in this process, when in fact all we're doing is taking money in, investing it, and then writing checks for claims, meaning we, the insurance industry in Michigan. Certainly Mark, who's the CEO of a level 1 trauma center here in Macomb, could understand the financials, as could yourself or anybody else. So that's a pretty extraordinary circumstance, and that's why we want you, ladies and gentlemen, to go to the website, do the math, mi.org, and drill down on this topic, and then contact your legislator and insist that they compel insurance companies to provide all of this information. We honestly believe that the assertions by the insurance industry is deceitful, if not outright deceptive, with bald-faced lies, relevant to the unsustainability argument. For 38 years in Michigan, gentlemen, this model has worked perfectly. As a matter of fact, it's hailed by the Insurance Institute as the finest model in America. During the testimony that took place in Lansing in September, there were people that asserted or the insurance companies themselves asserted that no other state is interested in this, and yet we know that the governor in Florida, Governor Rick Scott, is very interested in adopting the Michigan model, because if you don't live in Michigan right now, you will, after a catastrophic injury, having sustained a brain injury or a spinal cord injury, you will go bankrupt, and then you will fall to Medicaid, where Medicaid provides none of the unique benefits that are contained in auto no fault. And then that becomes a burden to the state budget. Governor Scott sees he can create tens of thousands of healthcare jobs, which we're trying to protect here in Michigan. He can eliminate the bankruptcies to the citizens. He can reduce his Medicaid rolls and provide this compassionate, comprehensive resource for the care, the recovery, and the rehabilitation of our injured citizens. He can do that in that state. So it's really been ramped up, where insurance companies have gone to incredible extremes to try to deceive legislators that the sky is falling on this topic. Now, Mark, you're a level 2 trauma center at Macomb Regional Medical Center. Do you also provide home care to people that have suffered catastrophic injuries after the fact?
Yes, we actually do, through one of the other divisions of McLaren Healthcare. We have a McLaren home care service.
Awesome.
And so yeah, we do cover all the bases. One thing, John, that I think I want to try to make clear to folks is that if you think there's something wrong with the system, that's one thing, and I think we would all argue there isn't anything wrong with the system. But if you're going to make that argument, you got to make the argument in the context that what you're choosing as the alternative is somehow better than what you had before.
Well said.
And I think that's one of the flaws that I see with this legislation, because it's not just that healthcare providers are going to get paid dramatically less than they get paid now. It's that there's a ripple effect. So today, if I'm in a car accident, I know I'm going to get covered. I know I'm not going to have to worry about my own personal financial viability. And I know I'm not going to have to fight through a morass of litigation to take care of myself or my family member. And under this new system, that would all go away. So people who are in the same kind of situation, if this bill were to be put into effect, all of a sudden now they have to worry about, first of all, how is the bill going to get paid? If they don't have enough insurance coverage, or if it's such a huge accident that they're going to require care for virtually the rest of their lives, do they have the personal assets to deal with that? And if they don't, well, now let's go to court and let's litigate this. And all of that, you got to worry about all of that while you're trying to
while you don't have the resources,
health, and it just doesn't make sense to me in a logical way to say yes, that system, that potential system would somehow be better than what we currently have right now in front of us.
Well, and that's very well said, Mark, and thank you for elaborating. The fact of the matter is, those of us that are in the home care arena here in Michigan providing care for this population we're set back on our heels and staggered by the insurance companies' offer, if you will, in the proposed bill to pay agencies $11 an hour for a home health aide and $17 an hour for a registered nurse. It would absolutely destroy our industry overnight. And it's wrong. I mean, it violates all the basic tenets of contract law. People bought their policies, as you mentioned, John, and the money is in the MCCA, the Michigan Catastrophic Claim Association, and it was put there by citizens for citizens. So we're very concerned about the impact that would have on the present day population of people that have suffered injuries, as well as those in the future who clearly will go bankrupt and fall to Medicaid and not get their benefits. Now, a lot of viewers probably are unaware that the unique elements of the auto no-fault law include aggressive persistent therapies while you're in the acute setting, a subacute opportunity to go to a rehabilitation center and get specific therapies, just like Gabby Giffords got, the congresswoman who was shot. She's making great improvement because of these aggressive persistent therapies. After you leave that scenario, you then have the option of going home and getting your home modified if necessary, electric wheelchairs, aggressive persistent therapies in the home, all your medications, all your medical care by physicians, any surgeries you need, hospital beds, round-the-clock nursing care. Many of our clients at Health Partners Home Care require ventilators, they're brain injured and or spinal cord injured, and they require 24-hour RNs and 24-hour home health aides at the same time to meet their needs. All of that would evaporate if this bill proposed would pass. John, how would this bill impact rehabilitation for accident victims and injured members of our armed forces and who are brain injured or spinal cord injured veterans? How would that impact all of them?
Well, we'll talk about the veterans first.
Yeah, please do.
They're overseas right now. They're fighting in a war. They're getting injured, and the number one signature event that's happening out of the war is TBI.
That's right.
Traumatic brain injury. Our VA system's working hard at handling the influx, but they have gone out gracefully out into the private market, out into facilities like mine, and they are allowing us to really serve the veterans, and we appreciate that. We're honored by that. In fact, Michigan's system and model is so good that 4 of the 21 centers in the country are here in the state of Michigan. And that's because of the model we put together with the auto no fault. We've been allowed to really put all the pieces together to help serve our veterans, especially returning from war. So we're real honored to be able to do that. And Michigan especially, having 4 of the 21 in the whole nation right here, it speaks volumes of what we do for folks. From my perspective, I'm the post-acute rehab. And so what happens in our world is that the funding, the pool would get smaller because they're saying that the clients would be grandfathered in. And so people after July of next year would no longer have no-fault coverage. So people injured after that period of time would then start to fall off, and that pool of helping people would start to get smaller and smaller and smaller. So right away we'd feel a rather large impact. And facilities like mine, for the most part, and even in other states, don't exist after a few years. So they lose their funding sources, they usually cannot diversify in time. And so these unbelievably wonderful centers, which we have all over the state of Michigan, would start to go away. And then, just like with the Gifford case, is they had to look for quality rehab centers. And the reason they had to go to different states is because they don't have multiple quality rehab centers in the state. So they have to find that next level. In the state of Michigan, like our hospitals and some are, we have it all right here.
That's right.
That we have a phenomenal system set up just to take care of people, and it's beautiful. I have come from other states, and in other states that's what happens. The last few rehab centers standing end up getting to take care of a few of the clients, of a few of our patients. But for the most part, the funding goes away, and so do the people, and that's why it's called the silent epidemic. Eventually they fall off of the healthcare roll. No one knows where they are, and the poor souls just don't get help, especially if they're catastrophically injured. So.
Excellent. And a lot of Michigan citizens are surprised and pleased to discover that in America there's 300 CARF accredited. CARF is the acronym for the accreditation body that talks about rehabilitation facilities as being top of the food chain. There's 300 of these in America, and Michigan has 150 of the 300. And that, as you mentioned, is largely due to this resource that we have in the auto no fault. I know that you were instrumental as one of the key people in talking to the Pentagon to make them turn their head and take a look at Michigan as a great resource for veterans. Do you have any idea of how many are now in Michigan taking advantage of our resources here?
We have right now, we have about anywhere between 9 and 11 getting help right now here in the state of Michigan. The BIA of Michigan was the proponent. They were the fighters. They were the people that went to DC. They were in front of the commission, and they're the people who made it happen. So our Brain Injury Association of Michigan is quite powerful. They do great advocacy for folks with traumatic brain injuries and spinal cord injuries. So they were the folks that were in the front lines making that happen. So they took our stories to Washington, and Washington said, we'd like to see how this system will really affect the outcomes to our soldiers, our fighting soldiers, and that's why we have that honor today, and I think that's why we have the majority of the people being cared for in the nation right now.
That's awesome. I think it's going to impact those veterans very favorably. Well, gentlemen, we're about to wrap up, and I want to thank you again. We'd like to thank our special guest, ladies and gentlemen, Mr. Mark O'Halla, the President and CEO of Mount Clemens Regional Medical Center, and Mr. John Cornack, the President of Eisenhower Rehabilitation Center in Ann Arbor, and the President of the Coalition Protecting Auto No Fault here in Michigan. Please join us and get involved in our organization as we try to preserve, protect, and strengthen the most beautiful no-fault model in America, as hailed by the Insurance Institute. And visit the website, dothemathmi.org, and then please contact your legislator and the governor and tell them to vote no on House Bill 4936. Thank you very much for joining us today, and have a great weekend.
Thank you, John.
Thanks, John.
Thank you, gentlemen.